In this video, we will review the main points of the First Nations Health Council Guidebook, Reclaiming Our Connections, the Next 10 Years. The Guidebook has 4 sections. Let's begin by recognizing that First Nations in BC have accomplished a great deal in health and have many accomplishments to celebrate. The creation of the First Nations Health Authority represents a first of its kind in Canada. British Columbia is one of the only jurisdictions in the world to have federal health services managed by First Nations people. It gives us the opportunity to exercise greater self-determination in health by designing and delivering services that work for us. The FNHC is also integral to embedding First Nations needs and priorities within the broader health system. As the FNHC matures as an organization and continues the work of program transformation, BC First Nations will have greater control over health services delivered to their people. A key part of BC First Nations health governance structure's success is a core set of values, our 7 directives, and our shared vision statement, which represents our collective goal: healthy, self-determining, and vibrant BC First Nations children, families, and communities. We use our agreed-upon directives as the framework for our decision-making. For example, our number 1 directive is that our work be community-driven and nation-based. BC First Nations have led the way in reclaiming control over our health and wellness. They have done so through a series of innovative and comprehensive agreements with Canada and BC, creating the cumulative effect of increasing First Nations control over their health and wellness over the past 15 years. BC First Nations created a First Nations health governance structure, providing a mechanism for First Nations health priorities to influence the broader provincial health system. This includes facilitating the transfer of health service delivery from Health Canada, First Nations Inuit Health Branch BC, to the First Nations Health Authority. It also includes establishing high-level partnerships with Canada and BC to address priorities related to health services and the social determinants of health. The mandate of the FNHC is outlined in the 2011 and 2012 consensus papers and the 2011 Tripartite Framework Agreement on First Nations Health Governance. Let's do a quick review of the role of the First Nations Health Council, which has several functions. First, the Council provides dedicated political leadership for the implementation of health plans. This includes providing continued political leadership of the Transformative Change Accord First Nations Health Plan and the Tripartite First Nations Health Plan. It also includes reflecting a philosophy and culture of trust, unity, honesty, humility, and healthy living, as well as incorporating traditional practices and teachings in operations, planning, and decision-making. Second, it supports First Nations in achieving their health priorities and objectives. This includes supporting community-driven and nation-based approaches, promoting individual health and wellness responsibilities, including self-care and health literacy, and promoting the transfer of health services to local and regional levels wherever possible, practical, and feasible. Third, it promotes health advocacy and relationship building. This includes knowledge sharing and collaboration with government partners and others at the highest levels, including internationally, advocating for service improvements for First Nations, and providing a BC First Nations leadership perspective on research, policy, and program planning processes related to First Nations health in BC. As part of this, the FNHC is mandated to develop relationships and alliances with other First Nations organizations, government ministries and departments, and others to achieve progress in the social determinants of health. Fourth, to politically oversee the transition of FNIH to a new First Nations Health Authority. And fifth, to promote and ensure communication, transparency, cost-effectiveness, and accountability of the FNHC to First Nations. This includes operating to a good governance standard such as an approved and transparent terms of reference, active participatory members, regular accountability and reporting, and an ongoing evaluation of the role and benefit of the FNHC. The engagement and approvals pathway is an 18-month process by which the First Nations Health Council and the First Nations Health Authority gather input and build consensus on key decisions. It is a critical component of the ongoing success of the First Nations health governance structure and is core to what makes our approach work. Through Resolution 2011-01, First Nations called upon the FNHC to design and describe a process for key decisions consistent with the 7 directives, and the principle of reciprocal accountability as adopted by the First Nations in the consensus paper. This workbook marks the beginning of an 18-month engagement and approvals pathway process and is intended to engage leaders on the ongoing role of the FNHC. This includes the Council's role in achieving progress on the social determinants of health and supporting nations to rebuild. Now let's look at Section 2, the social determinants of health. There's more to health and wellness than just the absence of sickness. More factors contribute to our overall health outcomes than just health services, although they are still very important. In truth, poor health later in life is usually determined by circumstances earlier in life and the environment we grow up in. It is now acknowledged that a comprehensive and integrated approach to healthcare is needed to address risks and the root causes of poorer health. A full continuum of services and supports includes not only treatment, but also a much broader spectrum of services delivered collaboratively across social sectors. This means that multiple sectors, community health centers, schools, daycares, employment agencies, and courts, as well as policing, housing, and children and family agencies, all have a role and responsibility to provide services that promote health and well-being. The social determinants of health are the things that influence the health of individuals, families, and communities. It includes things like culture and language, early childhood, physical environment, and education. This is not a new concept for Indigenous people. We have always viewed health holistically. Each nation has stories, teachings, and traditions that speak to the connection between the mental, physical, emotional, and spiritual dimensions of well-being that are key to a healthy and balanced life. While there is diversity among First Nations in BC, we are united by the First Nations perspective on health and wellness. At the center of this work is our vision statement: healthy, self-determining, and vibrant First Nations children, families, and communities. The FNHC has engaged on the social determinants of health since 2015. Through this engagement, leaders stated that mental health and wellness was the top priority across BC. In addition, they noted that a new funding model was needed, one that was flexible, reduced reporting burdens, and incorporated a social determinants lens. The 2018 Memorandum of Understanding between Canada, BC, and the FNHC is based off of this feedback from leaders, and it provides funding for a wide range of activities including planning, collaboration among First Nations communities, designing new programs, and demonstrating innovative and integrated models of service delivery. The MOU sets the stage for discussions on the 10-year strategy for the social determinants of First Nations health and encourages our partners to support our community-driven, nation-based approach. Moving forward, the FNHC will engage leaders on key priorities to inform a 10-year strategy on the social determinants of health, including the role of the FNHC, regional and provincial priorities, and the role of nations and communities. Now let's look at Section 3, Nation Rebuilding. Nation rebuilding refers to the process of remembering and reclaiming our traditions, culture, language, and relationships. Colonialism has served to erode many of the things that kept our people well for thousands of years, dissolving our bonds and isolating us into individual Indian bands. Nation rebuilding is a complex process driven by First Nations leaders, caregivers, and citizens. It involves coming together as nations in a modern context, with nation-based models of service delivery that provide all communities with a high standard of service. Nation rebuilding requires all of us. It takes the collective efforts and resources of First Nations, Canada, and BC to ensure success. First Nations organizations such as the First Nations Health Council have a role in supporting nations to do the planning and governance work necessary to self-govern, to relate to Canada in a nation-to-nation relationship, and to deliver services previously delivered by partners. Moving forward, the FNHC will engage chiefs and leaders on how best to support nation building regionally and provincially, and the best structure of the FNHC to support this nation rebuilding. The FNHC also wants to hear which other First Nations organizations should be included in this work. Let's look at Section 4, the Engagement Pathway. The FNHC is guided by the Engagement and Approvals Pathway, which outlines an 18-month process of engagement and dialogue when making significant province-wide decisions regarding roles, responsibilities, and mandate. The Reclaiming Our Connections, the Next 10 Years Governance Guidebook begins this process. Over the next 18 months, the FNHC will employ the Engagement and Approval Pathway to engage with chiefs, health directors, and leaders in order to develop an advocacy agenda related to the social determinants of health and to outline the role of the Health Council in supporting nations to rebuild. We will ask leaders to think about regional priorities as well as areas where the Health Council can advocate on a provincial or federal level. Here is an overview of the engagement activities over the next 18 months. The first step is engagement. The FNHC launched the Governance Guidebook at Gathering Wisdom 10 in January 2020, starting the process of engagement through regional caucus sessions and regional health assemblies, sub-regional caucuses and nation assemblies, and direct engagement with communities as needed. Engagement questions will be developed to spark discussions about the appropriate roles and responsibilities for each group, as well as which First Nations organizations we should be working with to achieve progress and the best structure for the FNHC. The second step is the development of a discussion document. In winter 2020, a draft discussion document will be created based on the engagement. This will be presented back to chiefs and leaders for further engagement at the Regional Governance Caucus. The third step is an engagement summary. Based on the discussion document engagement, an engagement summary will be prepared in spring 2020, providing a description of the common areas of agreement among BC First Nations, including regional social determinants of health priorities. The fourth step is building consensus. After the engagement summary in fall 2020, engagement will focus on further amendments to the summary to help build and capture consensus. Chiefs and leaders can expect to be engaged at individual communities, community meetings, sub-regional and nation assemblies, and shared regional health assemblies, and finally, at the Winter Regional Governance Caucus, where chiefs and leaders will be able to review and provide feedback on what we've heard to date. The fifth and final step is ratification. In spring 2021, a draft consensus paper will be rolled up from the regional summaries that also includes a resolution. The draft consensus paper and resolution will be presented back to chiefs and leaders at Gathering Wisdom 11 for review and approval, and we encourage everyone to share their voice. This concludes the summary of the Reclaiming Our Connections workbook. On behalf of everyone involved in this work, thank you for joining us and for your help in supporting healthy, self-determining, and vibrant BC First Nations children, families, and communities.